Welcome to the Patient Assistance Tool. This is a software program designed to aid interaction between patients and doctors. Today we're looking at the interviewing wizards. So we're going to look at the chronic pain wizard. This is a biopsychosocial wizard. It's designed to evaluate that particular aspect of chronic pain. It's been heavily influenced by articles written by the Hunter Integrated Pain Service. This program is designed to be used during acute consultations between GPs and patients. The ideal way to use this is to turn the patient screen so that the patient can see it, give the patient the control of the mouse, and the doctor's role is therefore to answer questions for the patient and to advise the patient as necessary. But predominantly the patient should be doing this in the consultation. So, first of all, there are a number of educational screens. The first one explains that chronic pain definition is that it must be pain lasting for at least 3 months. And then it basically explains that there are a number of factors in chronic pain, such as psychological, biological, social, environmental, and cultural, which influence chronic pain. And we are going to try and identify those today. Probably one of the most important factors is that all pain is transmitted by nerve pathways up to the brain where it is interpreted. The pain may actually be felt peripherally, and it may be different types of pain, but the pain is interpreted and generated in the brain. It's real, it's not just in your mind or made up, it's not your fault, but it's controlled from the brain. We can't cure all pain, tablets help, but really sitting passively waiting for the tablets to work is not the ideal thing to use. It can be a trap, and we're going to concentrate on looking at those things you can do to help yourself. The really good news is this concept of neuroplasticity. The brain can be changed by chronic pain, but neuroplasticity means that the brain can change. If we can identify factors that will help the brain, it may take some time, but the brain will alter and we will feel different. So we're going to try and reverse the changes that have occurred in the brain with the chronic pain. Everyone knows that a healthy lifestyle means a healthier immune system. The body is capable of repairing itself. There are lots of sensible things that you can do. So what we're trying to do here is we're trying to identify the 5 main areas that you can work in that will significantly help and build up a healthy lifestyle. So, for instance, the patient may actually be eating pretty sensibly, not smoking, and being careful with alcohol. And so there are 2 out of the 5 possible things that you are already doing, which is really, really good. But there are a couple of other things that you could actually work on. This will summate in the summary at the end, and it forms a program that you can work through with your doctor. So click on next. So yellow flags are listed for chronic pain. What we have done is we have converted this to a CBT, or a cognitive therapy model. And cognitive therapy, to put it very simply, says it's our main form of psychotherapy. It says that there is an A, which is an activating event. In this particular case, it's chronic pain, and it's interpreted by a belief system or how we think, and it produces a consequent emotional response, a consequent behaviour. And so if we can identify what our belief is, then perhaps we can work on that belief and develop or dispute a new belief which is more helpful to us. So this wizard is designed to help this. So if we click on this one here, which is this pain is harmful to me, means when I get pain it means I'm getting more damage done to my body. If I think that, well, if we go to the next one, this one helps us to develop a new belief system. And so if we can think of the pain as hurt from a scar rather than harm, it's sort of like going to the gym where you get some muscle aches and stiffness. Okay, it's acceptable to do that. We can work into the pain. It doesn't mean bad things are happening, and it will enable us to recover physical strength and ability to do things that you used to. So a very simple summary is no pain, no gain. If the belief system is that this pain is disabling, there are lots of things I cannot do and never will be able to do again, if we look at that particular belief, if we think, this is a new belief, if we think, yes, I do have the pain, if we accept that we have the pain, and then if we can concentrate on all the things, the many things that we can still do despite having the pain, and then perhaps after we do that, we can make a list of the things that we've stopped doing because we had the pain that we think maybe we could restart again. So in other words, a very simple thing would be think can do, not can't do. If our belief is that this pain means that I have an illness, that I'm a sick person, and I'm not going to get better until a cure is found, well, thinking of pain as sickness tends to put us on a downward spiral. If we can think of concentrating on wellness and aiming for wellness, it will put us on an upward path. So if we can change our belief to wellness, not sickness. And finally, another common belief is that this pain is just controlling all of my life. It's taken over everything. And so it is really controlling your life. So if we look down here, really the pain is driving our car. So if we can say, who's driving my car? Is it going to be me or the chronic pain? And if you can think of taking control back, and this will enable you to be able to do a number of things to improve. So once again, 4 main beliefs, and each of them has a disputing belief which is triggered by whichever screen you press. Cognitive therapy also says that there are 6 primary emotions. I guess a good way of explaining it is there are 3 primary colours, and all the colours in the world can be made up from that. So there are 6 primary emotions, and of the 6 primary emotions, surprise and love are not evaluated by CBT, appropriate for chronic pain. So really there's only 3 emotions that are relevant for chronic pain: anger out, anger inwards, sadness, or fear, anxiety. Life is full of stresses, and sure, we can't control all our stresses, but sometimes we can change things to reduce stress in the area. So this is just a systematic way to work through. So if there's anything at home that's causing stress, if you click that button, it's something we can work on. Perhaps work, current work situation, looking for work, off work, relationships at work, financial matters, social relationships. And then finally, after looking at things today, where would you like to go from here? Would you like your doctor to help you make changes? Would you like to try and make some changes for yourself? You can make as many or as little choices as you like. Finally, what happens is that this summates at the end. So this gives a summary. So we have the lifestyle suggestions of things that could be added. We have looked at belief patterns, we've looked at the emotions, we've looked at areas where stress is being generated, and your current choice. So if you just click on copy all and then move to your normal records, and right click, drops into your normal records. It's compatible with any Windows-based system.